Okay.
I'll go very quickly. Like Margaret, I volunteered with WHO at the end of July. I expected to be sent to Sierra Leone where I'd worked before, but the outbreak had just started in Nigeria. Basically, the story in Nigeria, and this may have some relevance for Ireland, a man from Liberia, who was a Liberian-American diplomat, flew into the airport in Nigeria. He was sick in the airport. He was collected by a driver. He was brought to a private hospital where he denied any contact with anybody with Ebola. He was admitted. There was an index of suspicion, so he was tested. The result came back 2 days later, and he was positive, by which time a lot of healthcare workers and a lot of other people had been in contact with him. This is Nigeria. Nigeria is the most populous country in Africa. There's 200 million people approximately. The commercial capital, the state capital is Abuja in the middle. The commercial capital is Lagos. And this other city is Port Harcourt in the east, which is the centre of the oil industry. And the outbreak spread there, and I'll explain how that happened. Lagos is a huge city. It's got extreme wealth. It's got diamonds. It's got oil. It's got all sorts of things. It's got huge slums. It's got major, major problems. And it's incredibly busy. There's enormous traffic. There's people trading all over the place. And when the American Consul General heard that there was Ebola in Lagos, he said that the sentence that had Lagos and Ebola in it sounded to him like the apocalypse because of what was happening in Liberia. So there was a real fear that something disastrous was going to happen. So the chain of infection had to be broken rapidly. And Margaret's already shown you the kind of outbreak control approach that was put in place. The Federal Ministry of Health and the State Ministry of Health for Lagos put in place immediately this outbreak control team that was led by people who had been running the polio control campaign in Nigeria, so they're experienced in managing outbreaks. So there's all of these different dimensions to it, and I'll just flick through some of these and some of the issues because they have resonance for us as well. As I said, there are all sorts of partners in this. MSF were involved very early on, and MSF are fantastic. MSF know how to set up treatment centres. They know how to they have anthropologists on the team for community mobilisation. They have water and sanitation experts for waste and water and all. They know how to put the whole thing together. And the other really striking thing in Nigeria was the huge number of volunteers. All kinds of people from the community came forward saying, I want to do something, and what can I do for Nigeria? Julie already talked this morning about breaking the chain. Like we have to identify cases and isolate them, and we have to identify contacts. And the big issue is if we have a contact that we miss, that Ebola may be spread. This is the treatment centre in Nigeria. In Lagos, one treatment centre was set up in an old TB hospital. It's not a tented one, but it's not like the NIU either. Here are staff with buddies putting on and off PPE. And another thing that's slightly different there is that when you come out of the treatment centre, you're hosed down with bleach. This is the outbreak in Nigeria. The red boxes are people who died, the blue boxes are healthcare workers, and the green boxes are people who survived. This person here is the person who picked up the first guy in the airport in Nigeria, in Lagos, who then went underground. He was a contact who went missing. He flew to Port Harcourt, where he got a doctor friend of his to look after him in a hotel, not in a hospital. The doctor is the healthcare worker who died subsequently, and the outbreak passed on to other people. But the outbreak was controlled in Nigeria, and as you know, there haven't been new cases. And these are the sorts of numbers. From that one case, there were 20 cases overall, of whom 8 people died. 11 of the cases were healthcare workers, 9 of whom acquired their infection before the diagnosis was made. There were 898 contacts traced, which is 99% of the contacts were traced, basically. All of these people were visited daily for 21 days. And the other thing that was done there for social mobilisation, around every case and about, depending on the level of contact, a circle was drawn around their house, and every house was visited to talk to people about Ebola and to stress hand washing. The data was managed really well with smartphones, light years ahead of us in terms of data collection, supported by eHealth Africa and other NGOs. Huge issues around stigma and having to provide certificates for people once they're treated so that they can go back to work and so that they're not isolated completely. The internet and social media are really important in Nigeria, even though it's a rich country and a poor country. But this disease and this outbreak was in middle-class people. It was in healthcare workers and people who had been in contact with that diplomat in the first place. So the website, Twitter, Facebook were hugely important. There were Twitter chats every second night with people asking questions and dispelling rumours. There was a huge amount of public information. The social mobilisation teams that Margaret mentioned went out house to house, talking about Ebola and demonstrating hand hygiene and hand washing in the community. And children there are really well informed about hand washing. Global Hand Washing Day was a few weeks ago. We didn't know about it in Ireland because we don't do it here. But in 80 countries in the world, on the 12th of October, every child washes their hands at the same time. And it's a huge thing around behaviour change. It's something we really need to think about. Media was hugely important, and the role of the media. They managed very differently to here, and a lot of rumours to be dispelled. The other aspect of the media, Nollywood is the third biggest movie industry in the world. You've got Hollywood, Bollywood in India, and Nollywood. So Nollywood stars made TV skits, made soap operas, made radio announcements, all sorts of things like that. You can go on the Lens on Ebola website and see the sorts of things they've done in different languages. The church is hugely important, and a big issue around the contact tracing in Nigeria is that many people, when they're unwell, go for healing and the laying of hands. So 2 of those cases had over 200 contacts each, most of whom were people who had laid hands on them in the days that they were unwell before they were admitted. I mentioned the issue of anthropology. There's only one textbook on the anthropology of Ebola. There'll be more before the end of the year, I'm sure, but it's out of print. But the plague doctor picture from the 12th century is there straight off. You've seen that slide already. The countries where Ebola is now are Sierra Leone, Liberia and Guinea. And there's very little traffic to Ireland from those countries. Very few people, the numbers of people weekly that would come to Ireland from those countries is very few. So the risk of us getting somebody from those countries is very little. The huge success in Nigeria. The outbreak was ended on the 20th of October. These are the 3 doctors in the private hospital, the 3 healthcare workers who recovered. They recovered with oral rehydration only. And they're stressing that early intervention with oral rehydration is important. We've heard already, younger people are more likely to survive, but oral rehydration with early intervention is hugely important. And Nigeria there are lessons, for the world around the management of it, about a command and control structure, about a way of they put this structure in place, and it was taken extraordinarily seriously at all levels. You've seen some of the other slides around the other parts of the world and the projections that things could get much, much worse. And while it's encouraging that there may be a reduction in numbers at the moment, it's very unclear if this is, outbreaks go in waves. So we have a lot to learn about what we can do in Ireland from Nigeria, and what we in Ireland can be doing in West Africa as well. You may have seen this map in the last few weeks. I don't know how many of you are aware of calls and ambulances that have brought people from countries that are not affected to hospitals in Ireland. It's very important. There's a basic question about, that's the first question, where did the person travel to? There's also the danger of screening and identifying people, stigmatising. I think this is really serious. This is a really difficult and dangerous situation. People are being stigmatised straight off because of where they're coming from. You've seen the HPSC website and you're aware of the HPSC guidelines. So the things that we need to do, this is fundamentally an issue of inequality, a global inequality. This is a disease of poor people in the jungle that didn't matter. It isn't even counted as a neglected disease it's not even still counted as a neglected disease. It's a rare disease that we're now very concerned about. But there's a big issue about the right to health that this raises. We need to inform ourselves, and as healthcare workers and the public, we need to counter the totally irrational fear among healthcare workers and among the public. It's out of, the level of fear in Ireland is out of proportion, and we need to correct that, and we need to be sensible about it. We need to recognise the interdependence, the interconnectedness of the world, and to partner more with agencies and organisations that are working in these countries. And we can contribute to strengthening those health systems that are in huge trouble. And we all have a role in doing that, both, not necessarily travelling, but we can support people who do, and we can support organisations that are working to do this. The whole infrastructure of the health system needs to be built as well. And there's a huge research agenda in this that we could be part of, and we all need to learn and continue to learn more, and days like today help us do that. Thank you.